Hello and welcome to Laugh and Learn About Childbirth. My name is Sherry Bayless and I will be your guide throughout this journey. I'm a Lamaze instructor, lactation consultant, RN, and mother of twin boys. My sons were born in 1995 and they're my greatest accomplishment and joy. In a few moments you will see 5 couples join me here for a live childbirth class. We'll cover all the information you need to know, but most importantly, find out why I'm sitting on this big pink ball. So sit back, relax, and have some fun. In this segment, we're going to cover women's anatomy and the 6 preliminary signs of labor. So before we get started, I'd like to introduce everyone around the room so we get to know who everybody is. Hi, what's your name?
Chris.
Hi, Chris. So can you tell me why you're here?
Well, this is my second child. The first one, I had an epidural.
Okay.
So this is my first time doing it naturally. I plan on not having any medication.
Good for you.
So that's why I learned the Lamaze, and I'm 4 weeks away from my due date.
She's 4 weeks away from the due date. Welcome to class. Hi, what's your name?
Peter Wiley.
Hi, Peter. Why are you here?
I'm here with my wife, and we're getting ready to have, as she said, our baby naturally. And so we're here for our Lamaze class. So
Got it.
we're excited to learn how to do this.
Good. Are you nervous at all?
Not really yet, but yeah.
Yeah.
We'll see.
I know you always get a little nervous. You always get a little nervous. Hello, what's your name?
Hi, I'm Lisa.
Hi, Lisa. So when is your baby due?
Well, we're 8 weeks away.
8 weeks away. All right.
This is our first child,
Yeah.
so I'm here to gain kind of like the most knowledge I can before
Absolutely. Have you been doing any reading?
Not really.
Not really. Is that amazing? How many of you, the minute you found out you were pregnant, went out and bought like every book there was on the bookshelf and read it by month by month? Did you read it month by month? Yeah, usually most women read it month by month. Month 1, honey, pay attention. Month 2, you're not listening. Month 3, this is really important. Month 5, it went under the bed. I'm bored with this book. All of a sudden, Lamaze classes are starting. We better read that labor and delivery chapter. We didn't read that yet. Most people do their reading ahead of time just to feel like a little bit more, involved. Welcome to class. Hi, what's your name?
I'm George.
Hi, George. So why are you here?
I'm here
Yeah.
to show support.
To show support. You know what that is? A lot of people used to think that coming to these classes was all about being a coach. I need to coach my wife. And some of these gentlemen would show up in the hospital with, with the stopwatch around their necks and the hats on and the coach across the chest. And the newest thing in our business is all about being a support. And that's what women want in labor. They don't really worry whether their husbands are going to breathe with them. All they're going to worry about is they hold their hand and be there for them. So you're here for the right reason. Thanks for coming. Thanks for coming. Hello, what's your name?
Hi, I'm Stephanie.
Hi, Stephanie.
We're about 15 weeks from our due date.
15. You're our smallest belly
Yes.
here. That's good. So
I've read every book. NASA has planned less than I have for this birth.
I'm sure you have.
Yes.
Absolutely. Yeah. Well, being forewarned, you have to
Yes.
know what you're doing, and I think it's
But
easier.
I just want to do Lamaze because I don't want to freak out during labor.
There you go.
So-
I think that you're,
Stay centered. So.
It is, and the thing is that I've watched over the years is what is people who are Lamaze trained or people who've been to childbirth educations, they just feel so much more confident when they walk in the door rather than, I don't know what's happening and why is this painful and where are we supposed to be? And it's just so frightening all around. So I'm glad you're here. Welcome to class.
Thank you.
Hello, what's your name?
Roger.
So Roger, why are you here?
Well, we're type A personalities, so
Okay.
it's all about being prepared.
There you Okay, so here's the question I like to throw out to the men and the ladies as well. Who's held a baby? Okay, you guys are excluded because you got the 7-year-old at home. But who's held a baby in the last year? Held a baby? Okay, just a few. Anyone changed a diaper in the last year? Ooh, nieces, nephews? Nieces, nephews. Nieces, nephews? Friends.
Friends.
It's so funny when you're pregnant, everybody starts handing you babies. Here, hold a baby. See what this is about, hold a baby. And that's the first time you really get a chance to do that. It's not true, right? And then there's that other thing about the women stopping you on the street and touching your tummy too. That's a whole nother story, but we'll talk about that later. Roger, welcome to class. I'm glad you're here. Guillermo. Hi. Our one gentleman who doesn't speak English too much, he speaks a little Spanish. See?
Entiendo un poco.
Un poco, un poco. We'll have the wife translate for us.
Yeah.
Hi, what's your name?
My name is Joanna.
Hi, Joanne. So why are you here?
It's a little girl.
It's a little girl, so we're having a little
So
girl.
it's my first child, and
Yeah.
I'm a little nervous.
You're allowed to
So
be. You're allowed to be.
I would like to know about everything I can do.
Give me everything you know about having a baby, and I'll feel better.
Yeah.
Well, good. Well, I'm glad you're here.
Yeah.
Welcome, welcome.
Thanks so much.
Hi, what's your name?
Hi, I'm Rhodey.
What? Boy, you just skipped right over that man. I guess we know who runs the, okay, never mind. So, what's your name, sir?
Joe.
Hi, Joe. So why are you here?
I'm really here just to find out, I guess, what I can do to
There you go.
to be, a better support system. I don't want to be, the guy that's just kind of freaking out. And that's how I feel like I'm headed in the next 2 weeks. So.
And the guy who's freaking, they're heading in that in the next 2 weeks. Yeah, the guy freaking out isn't a pretty picture in a hospital room, and especially when you're there, you know. If you're at home, it's okay, but when you do it in a hospital, it's kind of scary. So I'm glad you're here, Joe. And last but not least, hi, what's your name?
I'm Rhodey.
Hi, Rhodey. So tell me, how many weeks away are we?
2 weeks away.
2 weeks away, like you said. Okay, and why are you here?
This is our first child, so we want to be obviously as best prepared. We both have big families, so everybody, wants to give advice and tell you what you're going to expect, but, we need to experience it for ourselves.
Absolutely. Let me give you a couple of statistics that are out there in the world these days. Basically, first babies take 10 to 20 hours to come. So if you put that in perspective, you think, oh, gee, 20 hours. But it's really one day of your life. I want you to know when my sons were born, it wasn't the day that I had them, it was the next 20 years I was concerned about, okay? So you just have to put that all in perspective. Also, some of you will have fast labors and some of you will have slow labors. And I know you've met that woman on the street that had the 78-hour labor and she decided to share, I was in labor for 78 hours. 48 of it was at home, 24 was in the hospital, and after everything, I had a C-section. Well, thanks for that news. I feel so much better now. Statistically, across the country, the C-section rate is changing, and it is going up, and that's a concern to all of us in the field. So one of the things that we're trying to stress, especially in our classes now, is about normal birth, about having that birth and not being afraid of having that birth. I think we have medicalized it to the nth degree. We've made pregnancy and childbirth a disease, so we feel that we have to fix it. And that's not it. Childbirth is really a natural event, and I think we've gotten away from that over the years. So one of the things that I'm going to try to do in this particular series is make sure you know that it's going to be okay, and pain is normal, and there's pain with a purpose, and laboring is okay, and you're going to make it. You're going to make it, and that's the good news. You're going to make it. All right, so let's get started.